Hey there, it's Jackie Ferris. And like many of you, I'm working from home this week because of the coronavirus. We were going to bring you something different on the 302 this weekend, but because the situation has ramped up so dramatically, we wanted to bring you a very special edition of the 302. If you've been watching the news at all, then you know more than 150 Americans have died because of the virus, and more than 10,000 of us are sick, and that is just in the United States alone. We're hearing from health officials that those numbers could increase. And now, in addition to all of this, our global economy is in turmoil, and a lot of us feel like we're locked down in our homes. Restaurants are closed. We can't go to church. We can't do a lot of the things that we're used to doing because we're worried about not just getting the virus, but spreading the virus to those who are the most vulnerable in our population. So with this special edition, we're going to spend the next half hour talking to Lieutenant Governor Bethany Hall Long about all of the things that are being done on the state and local level to make sure that you and your family stay safe and stay healthy. Stay tuned. The 302 is headed your way with some answers. Hey 302, we are here to talk about the COVID-19 or the coronavirus that's on everybody's mind. Everybody is staying home, watching the headlines. We've got a lot of questions, and we wanted to find out what was going on the state level. So we were reaching out to Lieutenant Governor Bethany Hall Long. She's here with us now to talk to us about what we need to know on the state level. Lieutenant Governor, thank you so much for joining us.
Yeah, great. It's good to be here with 302 and the listeners. Statewide, it's really important that the states be in junction with not only our federal level, but our local and state and county levels come together. And it really isn't just about government. I always start by saying it really takes the community and business leaders, kind of all hands on deck as we try to calmly and quietly figure through what we need to do in our communities without causing a lot of hysteria and alarm. Really important. And I want to say, as the chair-elect of the National Lieutenant Governor Association, we've had the opportunity to compare what best practices are across the country. And our governor, a week ago today, declared a state of emergency. And by doing so, he really put in place some protective measures. So like you indicated, we're trying to keep individuals safe. And initially, he called for groups of 100 or less. And that has changed over the week. So we have to be fluid and flexible. His order yesterday called for the continuance of 50 or less. And also, he had put in place a week ago, Friday, that schools be closed. And yesterday, he took it a little further to include here in Delaware, movie theaters, restaurants to be able to deliver carry-out food only or delivery, and also not to be going to bowling alleys or to not be going to other locations like spas and fitness centers. So again, every day, I think you're going to see across this country different protections. But the most important thing is to reassure people we're really basing it on our information from the Centers for Disease Control and our state public health leaders and our emergency management leaders. And that's what our governor has done. He's put DEMA and DPH leaders who know the facts, who've done this before, that we've done this here in Delaware with H1N1 and other measures with the cities. And we're working hard with the cities, with the counties, to keep people safe.
No, I know that's probably very comforting to folks that maybe they haven't thought about it, but we have been down this road sort of before. So people should be paying attention to what the guidelines are and really taking this seriously.
Yeah, absolutely. And this is a pandemic. And, in my other hat as a professor of nursing at the University of Delaware, I had the opportunity to talk a lot about this with students and others as they're learning. And again, it's what's a normal occurrence of a disease. And there is not a normal occurrence of COVID-19. And so anytime you have a few cases or a case, that causes alarm. And in Delaware, until recently, our cases have been pretty small. We've been tracking behind. I've been on the phone with Cyrus Habib, is Lieutenant Governor of the state of Washington. I've been on the phone with Lieutenant Governor Hochul out of New York, and they're putting different measures in place based upon the disease trend. And in our state, it started around University of Delaware, a single source. Right now, we're looking closely with the leaders in public health if it is into community spread. And if so, we really do, like you said, for people to take this seriously. Stay home if you're sick. If you do have to go out, social distancing. This is not the time to take your young ones to go visit grandma or great aunt. We want to keep those who are 60 and overprotected. Really wash those hands. And we can talk about those measures, before we end today a little more. I'd like to really reiterate those importance and those prevention strategies.
So as far as testing goes, I know that last Friday, Christiana Care, among other organizations, they had a drive where they tested a bunch of people, like 526, something like that, give or take.
Right.
So do we have the tests? Do we have the equipment necessary to take care of this in Delaware?
Delaware has been really fortunate up to this point. We've had enough test kits, but I think when I preface that and I say enough test kits, we've really tried to limit them to individuals who had those true symptoms. We know certainly nationally there was a slower response. Thank goodness, thanks to the leaderships of Congress and members of our Senate, and now the administration signing off more resources to our states, that will absolutely help. But thus far, anyone who has presented with fever that has lasted 24 hours or more over 101, with a cough or respiratory breathing problems, were the ones who were screened. I know a lot of folks were worried, and I understand that, and we certainly want people to call their primary care provider or their doctors, but we don't want people to rush to the ER because they have a sore throat or they have sniffles. Again, there are common colds and viruses and the flu that is going around. And, again, you want to distinguish those signs and symptoms. So again, stay hydrated, take your Tylenol. But again, common sense prevails. Pick up the number and dial. We have a call center here in Delaware, and we're really encouraging folks to use those resources, and not only in the 302 area, but if you happen to be listening into 302, depending on where you reside, each state has information available.
All right, we are talking to Lieutenant Governor Bethany Hall Long. We're going to be right back to talk more about those precautions. Stay with us.
Hi, I'm Tina, and I love watching the 302. Not only is it an area code, it's a place to watch.
Welcome back to this special edition of the 302. We are talking to Lieutenant Governor Bethany Hall Long about what's being done in Delaware to make sure that we are safe and we have what we need during the coronavirus outbreak. Now, Lieutenant Governor, let's go to some of the things that are being done. You mentioned a lot's being done on the medical front, but there are things that are being done that the governor has put in place in terms of businesses and helping those who really need our help right now.
Yes, in the state of Delaware, like many states across the country, are really putting in place testing and making sure people have those resources, whether it's drive-by or hospital systems. And a big shout out to hospital partners and the systems in the state, all of them, whether Christiana Care, Bay Health, BB, Nanacoke, AI DuPont, everybody's been stepping up in different ways. But in addition, our governor has issued this state of emergency, and I briefly mentioned before, had put this in place to protect not only our school children, but encouraging the social distancing. And by doing so, went from like 100 to 50 in a group, and really staying essential. So a lot of faith-based organizations are using their Facebook and their video streaming to have worship services. We have also encouraged, businesses for employees who can actually work remotely to do so, because we recognize when you close schools, you also eliminate a lot of childcare. And certainly that also impacts your health systems as well, because a lot of the parents have children in school. And so we've had a lot of organizations stepping up also. And the governor's protections that he also included, yesterday implementing for this morning, that movie theaters would be closed, bowling alleys would be closed, and fitness centers. And certainly I know that our governor and myself are very much into lifestyle and fitness and wanting people to be well. And right now we don't have restrictions on individuals going out, social distance outside for a jog or taking a child to a park around, walk around. But we are encouraging people to really limit that and to think about who they're interacting with. And again, avoiding persons over 60, making sure that you follow up. And we want people from those orders to also realize they have resources. So again, the governor put in place, the HELP program, the small business opportunity. So if you are a small business owner, the 0% loan, and other things in place. We also want individuals assured that you will have the opportunity if you do need government services. And we're seeing this at every level of government. The state administration has worked really closely with towns and county government to make sure that individuals who have service issues, whether getting unemployment from the state, whether you're applying for SNAP or TANF assistance with food programs, or at your city level, individuals who have had issues perhaps, with some of their public service issues, or at the county level, we know that many of the libraries and things have been closed, but we're making sure people have resources. So again, government has not shut down. We're just working a little differently. We're working remotely, and again, being there to answer those questions. So again, individuals should not be alarmed that, services will continue to be offered. And really, don't rush to the ED. If you are not really ill, don't go rush to the emergency rooms, because we really want to save those for persons right now who perhaps have the flu or other issues. Obviously, life continues. And again, we want individuals to be calm and resourceful. And we have ideas we can talk about later. We're really wanting people to think about their stress and how they're managing it. And so again, we have telehealth services and available should people need them while they go through this kind of unique pandemic experience.
Now, I know that you're telling everyone that government is going on as usual and they can be concerned. That's okay, but they want to be calm at the same time. And information is a very powerful tool in keeping people calm. And I know that there are daily updates. Can you talk about that?
Yeah, absolutely. There's daily updates. And I'm so proud of our leaders. Our governor had tapped the head of DEMA, our Delaware's Emergency Management Association, as well as with AJ Shaw and Dr. Carol Rattay, the Division of Public Health. They and their teams have just been doing phenomenal work 24/7, as have all of our cabinet secretaries with the agencies from labor to transportation. Those of you who've been traveling and up and down the state, you don't have toll workers touching money. I mean, everybody has thought about everything. And we just want folks to know that we are still present. Our resources are accessible to you. And, it's easier said than done. But I think perhaps I have this calm sense to myself in my public health background that I know those daily updates. For example, we know that today we have around 30 cases that we know of. We have the majority in Newcastle County. We have 3 in Kent. We have 4 in Sussex. Thus far, as of yesterday at 5 o'clock, and again, I don't know if that has changed, but as of yesterday, we had 3 of those persons that needed hospitalization. Everybody else was home and doing well. Our original case that started at the University of Delaware, again, all of them have been home, self-containing, socially isolating themselves, doing the things that they need to do. But again, it really is important. Oh my goodness. We take those precautionary measures, that we socially distance, that we wash our hands 20 seconds, soap and water, say happy birthday to yourself twice, cough into your sleeve, wipe down your workstations with something that's 70% alcohol. When you touch the bathroom door, when you're walking out, use a paper towel or a wipe. Just little things will go a really long way.
And I know that the Secretary Walker was saying that we should all act like we have the coronavirus, even though that's probably not going to be the case for most of us because of these precautions, because it's so important that we keep in mind that we're not just doing this for ourselves, we're doing this for our families, for our friends, for anybody we could come in contact with?
Absolutely, and for your neighbors. And Secretary Walker, like I said, has done a great job, her team, and really just reminding folks of this. And as you think about that as well, protecting yourselves, people are going to get a little lonely, social isolated, anxious. And so for right now, unlike some of the cities across the country, we are allowing people, and to limit themselves, but to do a run, to do a walk, get the fresh air, get the kids outside, kick the ball around. But again, not running and high-fiving and tackling each other, so children are going to have to adjust as well for the moment. But again, that's where we are today. Recording. This may be a little different, in a week or so, but we really want people to stay up to date and use their mindfulness, their coping, self-meditation. Take this time to kind of rethink, wow, I have a little time. I haven't really thought about some of these things. I'm hoping for some people it's some self-reflection. How much do they sleep? How much are they eating? What are the things they're doing to take care of themselves? So, when we get thrown a little lemon, we have to make lemonade. And so again, I can't emphasize enough, though, how important this is. I am not downplaying. I mean, it is absolutely critical that we pay attention to what our public health leaders and the Centers for Disease Control at the federal level are telling us. And before you know it, we'll be beyond this, and hopefully it'll be summer and we'll be at the beach and walking around and doing everything normally. So the more we listen, the more we treat ourselves like Dr. Walker recommended, that we treat ourselves like we're infected, the sooner hopefully normalcy can return.
Let's hope so. You are watching a special edition of the 302. We're talking to the Lieutenant Governor, and we'll be right back.
Hi, I'm Joe, and there's so much to see and do here on the 302.
Welcome back. We're talking to Lieutenant Governor Bethany Hall Long about what people who live in Delaware need to do to stay safe. Now, Lieutenant Governor, this is something that we've been down this road before, but it's different this time. We all are confined to our homes. We're working from our homes. We're getting a little stir crazy. Is there like a mental health piece to all of this that we should be concerned about?
There always is something whenever there's something, a new experience, any kind of change, and this involves change. And so, there are a lot of awesome resources out there, for those who have access to a computer, who can do searches. We have a lot of phenomenal psychologists, whether it's at AI DuPont Children's Hospital, and in our own state Department of Substance Abuse and Mental Health, under Director Elizabeth Romero and her team. They actually are making sure if someone does have anxiety and depression, that they can actually get the services they need. Our governor also, in his emergency order, has stepped up for those who want to receive telehealth services. The order included that individuals should be able to receive telehealth through the computer. We are also working to make tweaks to that where we possibly can, and if we can, to perhaps include the phone and other means. But right now, we have mobile crises available 24/7, and our Department of Substance Abuse and Mental Health have 3 phenomenal bridge clinics in each community, in each county, I should say, and they are making it available that they also will make it open to individuals. So if they're getting a little anxious, a little depressed, and we want to make sure with our 211 line and our Corona hotline and the DE Delaware Gov coronavirus, that people know that they can get the resources. Currently, we don't have to hoard and go buy 100 rolls of toilet paper and get a year's worth of prescriptions. We are leaving open our grocery stores and our gas stations and our, food markets and our drug stores are open right now. And so again, for a sense of calm, those things are being kept open. And so the more we just do social distancing, wash our hands, remain calm, and do these things and adjust to being at home, hopefully we can get a little better. And hey, take a walk, do a little exercise at the home, do some self-meditation, read a book that you haven't perhaps read in a while, cook dinner. And how about this, a concept of families having a chance to sit down and have dinner together. Maybe we're spread out a little more, but a little more social distancing. But, we'll try to see some of the good in these times of stress.
Now, I know a lot of folks have kids or grandkids and everything. What advice would you give someone who maybe they're having to explain to their child or their grandchild about what's happening? I mean, how do you take the fear out of what's happening for kids, if at all possible?
All right, and I can give a little here, but I would really encourage you. There's some phenomenally great websites that you can turn to for those who are looking to this, or apps on the phone. But really, I think the more normalcy and you can have a routine. Children pick up on parents' energy and anxiety, and I think we as parents, myself, a mom and a nurse, we have to project that sense of it's okay, we've got a new experience, we're protecting ourselves. And this is what we do with our neighbors. And I think as they hear mom and dad keeping a routine, some folks are writing out their little schedule. So we're getting up for breakfast from 8 to 9, we're having class and doing our online program, because a lot of the schools right now are bolstering up. Kids have got a 2-week vacation. So hopefully they're getting outside still some, not tackling and playing with each other. And I'm not telling moms to get play groups in the same room, combined together, but doing some structure. Structure is one of the most important things we can do with children and for our own benefit, whether we have children or not. And role modeling. Hey, we're going to check on our elder grandma or our neighbor. We're going to place a phone call. You may not directly go into someone's house. You may be knocking on the door, waving through, checking on that senior. Because a lot of our seniors, like my mom, doesn't have a computer, doesn't even use an iPhone, if you can imagine. She has an old flip phone. But making sure that people are checked on and have the food and the services that they need is also a rewarding, calming thing. When we check and help one another, it also eliminates some of our own anxiety.
So I just wanted to circle around to the information piece of it before we go. There is an email that you can send email questions to. You can also call a hotline. Can you talk to me about how you're staffing the hotline, and is there a question that is, not a good question when you call or when you email?
I think you should email all questions and all calls. There's never a silly question. You should always do that. And then also don't forget to contact your own healthcare providers should you have questions on symptoms. And, also resources. The 211 number in the state is still available. And I know you're going to be sharing the website and the email and the call number, but there are no silly questions at this point in time. If you're worried, call.
Definitely. So, and I guess final thoughts, we're all in this together. We're going to get through this together. What would you like to leave the viewers of the 302 with?
I think for the viewers of the 302, this is a fluid situation. Be flexible. Understand that right now we have the various resources, and that all of us, working together. And this is kind of a message that I've had as chair-elect of the National Lieutenant Governor Association, is sharing our ideas and best practices and letting the community know that this is a new experience, but by the time we will get through this, if everybody cooperates. Again, government can't do it alone, but working together, and to feel free to outreach not only to those call numbers and centers, but also any way that we might be able to help, how to reach us. And so I appreciate it. I've enjoyed having the opportunity to share some information today with 302, and thank you all. I think it's important that the media play a role in filling in the gaps, because like you said, when there's gaps in knowledge and information, sometimes we fill it with fear or worry that we don't have to. So I hope today's information has provided some helpful tips and tools that you might use.
All right. Thank you so much, Lieutenant Governor, for spending time with us today, and we will share that information. Stay healthy.
Awesome. Thank you. Thank you.
We'll be right back.
The state of Delaware posts an update on the coronavirus situation daily on its website. You can get that update at dhss.delaware.gov. You can also send an email with questions to uppercase DPHC lowercase ALL at delaware.gov, or you can talk to an actual person by calling the hotline at 866-408-1899. I'll leave you with one final thought. Remember, while you're keeping your social distance, that there are plenty of people who could use your care and your kindness right now, whether it's a neighbor who needs someone to pick up a prescription, or maybe just sending a note to a doctor or a nurse or a first responder who's out there dealing with the coronavirus firsthand. Remember, together we will get through this. That'll do it for this special episode of the 302. We leave you now with the very latest health update from the state of Delaware. Until next time, I'm Jackie Ferris. Stay safe and healthy in the 302.
We will do our best to help everyone in our state, every business, every employee through this, and we will get through this. The best thing that we all can do through this crisis is to flatten the curve, to reduce the spread now on the front end, and try to shorten the time when the virus will be tearing through our country. The best way to do that is to follow the hygiene advice you've heard 100 times, but we need everyone to pitch in and follow that advice. The guidance is pretty clear. Wash your hands over and over again. Cough into your sleeve if you're coughing. If you are sick, even if there are mild symptoms, you need to stay home and avoid social interaction to the great extent possible. And more importantly, as importantly as all this, protect that population that is most at risk. And those are our senior citizens and those with compromised health situations, our grandmothers and grandfathers, our moms and dads. I check in with my mom every day to make sure she's staying put at home. She's not out visiting one of my younger brothers who was sick, and she's following the rules. When your brother's sick and mom wants to take chicken soup to her, it's a tough conversation to tell her to stay home. But that's the kind of conversations that we all need to have. And so if we follow these rules and we stick together, as we do here in Delaware when we have big problems, we will get through this.